Welcome to the last part of the video. In this particular part, we will be talking about the openings into the thorax and the thoracic vertebrae. So, let's talk about the openings first. Well, there are numerous gaps that connect the thorax with other regions and separate the bones of the thoracic cage from one another. Well, there are some narrow and elongated intercostal spaces that separate the adjacent ribs, while relatively large apertures are present at the upper and lower parts of the thorax, known as the superior thoracic aperture and the inferior thoracic aperture. Well, the chest cavity communicates with the root of the neck through a narrow opening called the superior thoracic aperture, which slopes antero-inferiorly, means upward and forward. Now, this superior thoracic aperture is bounded posteriorly by the body of the T1 vertebra, that is the first thoracic vertebra, and laterally by the medial edges of the first ribs and their costal cartilage, and anteriorly by the superior border of the manubrium. The vessels and the nerves can pass to the neck and the upper limbs through this aperture. Not only this, but the esophagus, trachea, and the apex of the lungs also pass through this aperture. So, that's about the superior aperture of thorax. Now, on the other hand, the thoracic cavity communicates with the abdomen through a large opening, called the inferior thoracic aperture. Posteriorly, it is bounded by the 12th thoracic vertebra and the 12th ribs, while anteriorly by the xiphisternal joint. If you remember, it's the joint between the body of the sternum and the xiphoid process, and laterally by the curving costal margin. Well, it is the large muscular diaphragm that closes the inferior thoracic aperture. Now, various structures that pass between the thoracic and abdominal cavities, like esophagus and aorta, must either pierce the diaphragm and pass through the hole called hiatus. This is the esophageal hiatus, from where the esophagus passes, and this one is the aortic hiatus for the passage of aorta. Otherwise, the structures can go around the diaphragm, or you say peripheral to the diaphragm. Now, moving forward towards the thoracic vertebrae, well, there are 12 thoracic vertebrae in total. You can see here. They are situated in the middle of the vertebral column, with intervening intervertebral discs in between. Normally, only the thoracic vertebrae carry ribs, and these vertebrae have unique structures for that purpose. Well, here is how a typical thoracic vertebra looks like. Like the other vertebrae, thoracic vertebrae also have a body, a spinous process, pedicle, lamina, transverse process, and superior articular facet. Now, the thoracic vertebrae have 4 features, which distinguish them from other vertebrae. First one is that its vertebral body is heart-shaped. Next is the presence of demifacets on the sides of each vertebral body. What they actually do is that they articulate with the heads of the ribs. Now, another feature unique to them is the presence of costal facets on the transverse processes. These ones articulate with the tubercles of the ribs, but do remember that they are present on 1st to 10th thoracic vertebrae only, that are T1 to T10. And lastly, the spinous processes are long and slant inferiorly. This is because it offers increased protection to the spinal cord, preventing an object, such as a knife, entering the spinal canal. Now, the demifacets are actually the costal facets. Well, these costal facets are small articular surfaces at approximately the posterolateral aspect of the body. They are present at the junction of the body and the pedicle. Well, 2nd to 8th thoracic vertebrae are the typical vertebrae, and they have two costal facets on each side. One is located superiorly, superior costal facet, while the other one is located inferiorly, the inferior costal facet. These are the sites where the heads of the ribs articulate with the body. Adjacent typical thoracic vertebrae that are, of course, second to eighth, share the articulations of ribs. Thus, the head of an individual rib articulates with both the superior costal facet of the numerically corresponding vertebral body and the inferior costal facet of the vertebra immediately above. Because each of these facets carries half of the rib articulation, each is commonly termed demifacets, where demi means half, so that's why they are called demifacets. Well, T1 vertebra has a full costal facet, instead of a superior demifacets for the head of the first rib. Plus, it has an inferior demifacet for the superior half of the head of the second rib. But if we take T11 and T12 vertebrae, each have full costal facets instead of demifacets, because the heads of ribs 11 and 12 articulate only with their own individual vertebrae. Now, coming to the transverse costal facets, they are small articular surfaces on the transverse processes. So here we have reached the end of this part. For a quick recap, the thoracic wall forms the boundary of thoracic cavity, and the skeleton of the thoracic wall is known as the thoracic cage. At the midline of the anterior chest wall lies the sternum. That has an upper manubrium, the body of sternum in the middle, and a xiphoid process at the bottom. Also, there is a suprasternal notch, clavicular notches, and costal cartilage notches. As for the ribs, there are 12 pairs of ribs. First 7 are called true ribs because they are directly attached to the sternum, while others are not. So 8th, 9th, and 10th are called the false ribs, while the 11th and 12th are the floating ribs, having no anterior attachment for their costal cartilages. A rib typically has head, neck, tubercle, body, angle, and costal groove. Based on this, 3rd to 9th are the typical ribs, while 1st, 2nd, and 10 to 12th are atypical ribs. Now, the first 7 ribs connect to the sternum directly through the bars of hyaline cartilage called costal cartilages. 8th, 9th, and 10th ribs to the cartilage immediately above, while 11th and 12th ribs end in the abdominal musculature. Now, joints of the thoracic cage include the one between the manubrium and the body of sternum, the manubriosternal joint, then the xiphisternal joint between the body of sternum and xiphoid process, costochondral between costal cartilages and ribs, interchondral in between the costal cartilages themselves, costoventral between the body of the vertebra and the rib, and costotransverse between the rib and the transverse process of corresponding vertebra. Then, the aperture present at the upper part of the thorax is the superior thoracic aperture, while comparatively larger, present at the bottom is the inferior thoracic aperture. Talking about the vertebrae, we discussed that there are 12 thoracic vertebrae. Typically, vertebral body is heart-shaped. They have 2 demifacets and a costal facets on the transverse processes. They are present on T1, T10 only, and the spinous processes. So that was all for today. I hope you have found it informative. In our upcoming, we will be discussing the intercostal spaces, diaphragm, and their blood supply and nerve supply. So keep watching sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.